Hello, my name is Barbara Buchenau. I'm the Professor of North American Studies at the University of Duisburg-Essen, and I have the great pleasure to welcome you to an interview between two colleagues of mine from the University of Duisburg-Essen and our current Aurora Fellow, Markus Zepf from the University Paris-Est Créteil. And we're talking about urban studies, urban research, issues in urbanity, between a lot of different fields. So I'm in the humanities, and I'm handing over to Anke, who's at the University Hospital in Essen.
Thank you very much. My name is Anke Hinner. I'm professor for genetics at the Institute of Sex and Gender Sensitive Medicine at the medical faculty, and I'm happy to be part of this endeavor.
Thanks. My name is Susanne Möbus. I'm a professor of epidemiology and urban public health, and I'm the leader, the director of the Institute of Urban Public Health, and I'm very happy to be with my colleagues in this very nice team.
My name is Markus Zepf. I'm professor of urban planning at the University Paris-Est Créteil, and I have the great pleasure to participate in this endeavor as a current Aurora Fellow here at the University Duisburg-Essen. Thank you.
So we came together to ask ourselves what would be possible if the humanities, the university hospital, the field of medicine, and the social sciences, urban planning are collaborating on issues of urban research, but also urban education. So how can we improve the training of our students in the field of medicine, in the field of humanities, and in the field of social science in questions of urban change? And I would like to briefly ask our fellow Markus what he thinks after those 2 weeks of working together and how far we now are a little bit closer to inventing an urban research that branches or bridges our fields.
Thank you very much, Barbara. I am currently the co-director of a research program in urban health and environment, which is called ECT. And so I had the chance to present the first results of this survey of students cohorts of 2,000 students here at the university. And with these results, we could discuss with all of my colleagues here about the idea how can we understand the needs, the actual needs and the problems of students in an urban and especially a university environment. And so we found out that we have a lot in common, and that these questions are transdisciplinary and have to be treated in interdisciplinary way, and the Aurora network is a perfect frame for this.
Maybe I can ask Susanne to briefly explain how the public urban health feeds into this question of the urban.
Of course, in my eyes, perfectly. And just to explain, public health is just the question how we can promote the health of the population, so not the individual as in medicine, and or population groups. And of course, the urban thing is to focus on the situation in cities, neighborhoods. And so one of the questions is, why send we the people back, make them healthy in the hospitals and stuff like that, and send them back to the situations and the environment that made them sick. So this is one of the main questions. So how can we design our cities, neighborhoods to help the people to create a healthy life? Maybe. And sorry, of course, urban planning is one of our main disciplines we have to work with. And so we have to learn from planning, from the urban planning perspectives, and the other way around. They have to learn how much things they are doing and deciding which directly affects the health of the population.
And I think with Anke, it's been that way, that Anke and Markus were talking about the data that Markus has been collecting, and Anke had a question to him that he hadn't thought about, and maybe, Anke, you could bring it in.
Yeah, thanks very much. Yes, of course, I always try to get in the sex and gender specific effects and have a specific look on this side of the coin. And well, in medicine, surprisingly, this issue is not that well regarded, or sort of it starts to be regarded in the manner that it should be, really. And so I think there's really something that we can exchange about, and I'm really fascinated by your data that you gain from the students, and I think we can have the same questionnaires here and then compare whether, if it's better to study here or in Paris, or what are the differences in how to learn from each other.
And maybe the question, why am I involved in North American studies, if we're studying cities in Germany and cities in France? Well, one of the questions that we're asking ourselves is, how is all of this carried through stories? So what are the stories that people tell about themselves and their cities? And how are our cities affected by this global American idea of what the most healthy city is, but also what the most unhealthy city would look like. So that's, I guess, my story here, why I'm involved. But I'm handing over for the final word to Markus.
Thank you very much, Barbara. I think you mentioned the script research, and for me it was a real big discovery because Barbara introduced the very fantastic symposium with the words, if we want to have a look at the future, we will have to consider the past. And this is also something which is very important in my field of urban planning. So I think this phrase makes the bridge between our disciplines. Thank you very much.
Thank you all. This has been fun.